Sorry, I giggled and went red when Joe said, doctor, because I have got a PhD, but it's in 18th century history, so I don't actually use it when I'm talking about these kind of issues. I hope that girls and women will be safe, allowed to feel safe on streets alone. A lot of times, women with learning disabilities who reach for support are put through more pain after abuse because we're not listened to or believed. The waiting times were too long that I tried to commit suicide on more than one occasion or self-harm. I feel let down and failed. They kept everything a secret because I was a child. But of course, it happened to me, nobody else. So they should have told me what was happening. Good morning. It's absolutely lovely to be here. I wanted to start with the voices of survivors. Those voices flag the importance of viewing violence against women and girls as a cross-cutting policy issue. And I wanted to start there because I've been asked to talk about how key work being taken forward under the auspices of Equally Safe contributes to the goal of improving outcomes for women and children in Scotland, a goal that's shared by and across a range of policy areas. In those quotes alone, there's reference to safeguarding, adult support and protection, suicide, mental health, child protection, and street safety. And of course, if I was going to list all of the connections, I could go on and on and on. Those quotes alone from recent research, including research done as a result of DES funding, tell us an enormous amount about the importance of whole systems policy as well as practice approaches to life in the real world. I think sometimes policy is seen as distant, existing in an ivory tower. This should not, and indeed cannot be the case. Policy should drive practice. Policy therefore needs to be engaged with real life. The lives of survivors, but also the lives of practitioners and the challenges that they're facing in the real world. Challenges of enormous caseloads, sickness and financial challenges and so forth. A sense of the enormity and complexity of truly seeing the big picture and thinking about systems can be illustrated by this graphic that I've got up on screen at the moment. And I've taken that from our newly refreshed Equally Safe strategy that Councillor Chalmers referenced at the beginning of the morning. It's a list of all of the Scottish Government and COSLA strategy documents that are integrally associated with violence against women and girls, and therefore the Equally Safe strategy. Or also we could look at this connected list of legislation. Given the prevalence and impact of VAWG across society, its presence in and impact on all aspects of our lives, it's vital that policy ensures that VAWG is considered in all aspects of our lives and in every policy area. And I think really importantly, and again, Councillor Chalmers spoke about this in her introductory speech, the way that we frame violence against women broadly within the Equally Safe strategy as a fundamental violation of human rights means that we really are thinking about the impact of violence violence against women and girls, both on survivors, but actually on society, and particularly women and girls. Not just the survivors, but just the fact that violence against women and girls will have an impact on all of us, on all of our freedom and all of our potential. The fear of rape, for example, shapes the way that all women and girls think about how they navigate public space, how they get back and forth from work and from a night out. So it's really important that we're thinking in those broad harms approaches. If we're going to bring about societal, cultural and systemic change, we need to keep working collaboratively. This approach is at the heart of Equally Safe. We recognise that this unified and collective approach is the only way to effectively combat violence against women and girls. The strategy recognises that collective leadership can deliver systemic change if people bring an increased equality, inclusion and human rights perspective to their work. It sets out the necessary levers to lead to the change required. This collaborative approach is vital. All spheres of government and all sectors of society have a role to play in tackling this issue. While specialist organisations are crucial for supporting victims of violence, abuse and exploitation, the refreshed Equally Safe strategy emphasises that violence against women and girls is everyone's concern and that we all have a part to play. The strategy explicitly, I'm absolutely convinced that my slides are not matching up with my with what I'm saying. Huge apologies. I'm going to keep going because I'm aware of time. The strategy explicitly states that universal mainstream services are at the heart of this transformation. By designing and embedding VAWG awareness and trauma-informed practice in universal public services, we can ensure that early engagement and interventions can help to prevent further harm that requires later complex specialist interventions. In doing so, this will reduce the significant pressure on our public services and improve outcomes for the people using them. Of course, the vision and ambition of the Equally Safe strategy is only a necessary precursor to action. As many in this room will be aware, we're currently developing a new delivery plan to sit below the strategy. It's vital that the delivery plan is understood not as a list of actions for the Scottish Government, but for everyone. That's why we're engaging with colleagues in the justice sector, education, social work and health to ensure that we're all working together to make a practical difference. I'll be unable to talk about all the connections between Equally Safe and other policy priorities seeking to improve outcomes for women and children, but I will pull out a few key examples. In the course of our engagement, that's what I wanted to have up. In the course of our engagement, we've heard a lot about the need to ensure better links between VAWG and violence against women partnerships and other forms of public protection. As the strategy states, local public protection structures are critical for ensuring that we prevent harm and that we protect, respond to and support the recovery of women and girls experiencing harm. A public protection approach involving collaborative interagency working can ensure an integrated and consistent approach to planning and service delivery to reduce risk to harm to women and children and young people. Warm words. So what are we going to do? And when I say we, I don't just mean the Scottish Government, but collectively in the policy space to move rhetoric to reality. We're working with stakeholders to develop work on MARAC in Scotland. And this not only provides the opportunity to support best practice and sustainability of MARAC, but provides a space to consider connections with other strands of public protection work. The Scottish Government and Solus Public Protection Group have been working together to understand how, across local and national government, we can improve public protection services. This task is much broader than VAWG, but it's vital that VAWG is seen as central to any work undertaken in this area. I'm part of the Scottish Government working group that's progressing this agenda and ensuring that VAWG is at the heart of developments and that a gender lens is applied across the police. Furthermore, we've been liaising with the Alacho COSLA Improvement Service to ensure an effective deliverable within our plan for closer working. It's an important example of the dialogue between Equally Safe and other policy areas, how they fit together and contribute to each other's aims. Within Scotland, there's no legal definition of public protection. It's a term used to describe the many approaches used to prevent harm to the public. It also encompasses protecting people from harm and supporting their recovery from it. In the Scottish Government, public protection policy areas, including child protection, adult support and protection, offender management, VAWG, drug and alcohol and other substance use, suicide prevention and human trafficking actually sit across different directorates and across the portfolios of 3 cabinet secretaries and 4 ministers. And I think this gives a sense of the challenges faced in working collaboratively. And that's why effective governance is going to be so important to assuring that Equally Safe achieves what it's setting out to do and bringing these different strands together to avoid silo thinking and silo working. The Joint Strategic Board will be vital to the work, and members are drawn from specialist violence against women services and senior representatives in key statutory services such as the police, prosecution service, health, education, housing and social work. And as Councillor Chalmers said this morning, it's chaired jointly by her and our Minister for Victims and Community Safety. The Minister's also recently established an Equally Safe ministerial group, and this enables her to work more closely with her fellow ministers, ensuring that work across the portfolios is contributing to the collective push to address VAWG. And additionally, we are in the process of establishing a kind of cross-COSLA and Scottish Government leadership group where ministers will be meeting with the COSLA leadership, again to ensure that we're filtering across the spheres of government. I think I hope they don't sound kind of airy-fairy and high in the sky. I think they're important contributions to ensuring that a joined-up approach to policy making is there, because for me it's a joined-up approach to policy making that actually leads the way to a whole systems change and whole systems approaches in practice. So I'm going to end there because I've had the 2-minute warning probably 3 minutes ago. But I just think it is really important that we don't think of strategy and policy as being out there. It really needs to feed into practice, but also the reality of your work needs to feed up the way. And so I think that, you know, for myself and for Katie from COSLA, I guess we're here in the same kind of listening mode as Anna is in relation to the work around Safe and Together. We need to understand those realities so that we are creating policy that will enable that system change. And I'm going to end there.